Good evening, everyone. Thank you for joining for our second meeting on this online support network called Cancer Power Circle. Just a quick intro on Patients Engage. We are an online platform. A lot of you know us. We've been operational for 5 years. We focused on evidence-based and holistic management of chronic conditions from perspective of patients and family caregivers. And we strongly believe in the value of lived experiences and how being engaged and proactive about your health leads to empowerment and better decision making and better quality of life. I think quite a few of you, or at least some of you, have contributed to Patients Engage in the past as well. And it's been one of the topics we've talked about as to how to leverage the digital platform to stay connected beyond the support groups that you already are part of, so that we can reach people who don't have the benefits of those support groups. So as part of that, we started last month the Cancer Power Circle, and that was our first meeting. We talked about breast cancer concerns during COVID-19, and today we talk about preventing and managing breast cancer-related lymphedema. We have with us Dr. Rohini Patil, who is a gynecologist as well as a breast cancer survivor and a certified lymphedema therapist. Later on, as she said, Keka Roy will be joining, who's also a breast cancer survivor, and she will demonstrate the exercise. We are a team of Urvi, who is herself a breast cancer survivor, Sheetal, and I'm Aparna Mittal. So I'll just, and just for kind of hygiene, this session is being recorded. If you're logged into Zoom, you can ask your questions on the Q&A. And if you'd like to introduce yourself, that will be great. If you're watching us on the Facebook stream, please note only the first part of this meeting will be streamed because the rest of the discussion then becomes a support group discussion. And those of you who are watching on Facebook, join the Cancer Power Circle Facebook group if you are a cancer patient, survivor, or caregiver. And we have our handles. You can reach us on our Facebook page or on our website or Twitter, Instagram, YouTube, etc. Okay, and I'll quickly stop this because I think we have a lot to discuss. So thank you, Dr. Rohini Patil, for joining. And yeah, so Sheetal and Urvi, do you want to kind of take over, or Rohini, do you want to just start with the talk first?
Can we just go ahead with it?
Sure.
Sure. Without wasting any time, let us go ahead with breast cancer-related lymphedema.
Again, doctor is slightly not audible.
Yeah, can you just
Not
come
able
closer?
To hear me? Now you're able to hear me?
Yeah.
Are you able to hear me? Is that okay?
Yes.
Better.
Thanks.
Good evening, and thank you so much to give me an opportunity to connect to you all regarding breast cancer-related lymphedema. And breast cancer is the most common cancer for women in India, and it's but naturally, if suppose it's a common cancer for women in India, the negative sequelae what one faces as a breast cancer survivor are very important, and they really impact the quality of life of survivor. And that is very important. That is why it's very important to talk about it, make people aware of it, aware of the condition, aware of the management, and how to prevent it and how to take care of it. This whole session I would be dedicating to breast cancer related lymphedema and making people aware of it. Breast cancer related lymphedema is a condition which is chronic, progressive, debilitating, disfiguring, and disabling, and which impacts psychological, emotional, and physical health of the survivor. And every breast cancer survivor is at risk of developing it anytime in her life. And most important is this condition, this disorder doesn't have a permanent cure. Only what we can do is we can diagnose it early, and early detection is the key for successful outcome of the management. Or in other words, we can also say that if suppose we detect it early, we know the signs and symptoms, we are aware of signs and symptoms of this condition, we would be able to report it early, and once reported early, the diagnosis would be made sure what it is, and then accordingly the management can be done, and awareness about how to prevent it, what exercises should be done, and exercises and stretches included in your lifestyle really makes a difference. And although we don't have a cure, but then this condition can be reversed back near to normal. Near to normal means the circumference or the size of the limb, in this case breast cancer lymphedema, it's an upper limb. Like I am affected on my right side, so my right limb is at risk of developing lymphedema, but then it is not only the limb, not only the fingers, the forearms, the arm, but yes, it is truncal lymphedema also, including the breast. If suppose you have undergone the breast conservation surgery, breast, the chest, and the back. So this is what includes the breast cancer related lymphedema. And one has to know that 70% of truncal lymphedema are underreported. They are go unnoticed. They are ignored. People don't even come to know that yes, they are having a truncal lymphedema.
Right. Can I just ask, doctor, if you can also summarize in Hindi, because I think there's some request
yes,
from some.
yes,
Sorry.
yes, yes.
Yeah.
ये जो ब्रेस्ट कैंसर रिलेटेड लिम्फेडिमा होता है, ये एक प्रकार की सूजन आती है हमारे हाथ को, पर ये सूजन बाकी के सूजन से अलग रहती है. ये स्वेलिंग भी हम उसको बोल सकते हैं, ये अलग रहता है नहीं, बल्कि ये सिर्फ उंगलियों में, हाथ में, पूरे हाथ में आता है, पर ये हमारे आगे के चेस्ट को, हमारे स्तनों को और हमारे पीठ को भी आता है. पर यही जो जगह है, पीठ, स्तन और हमारी छाती के जो हिस्सा है, ये कहीं तो भी हम रिपोर्ट ही नहीं करते, क्योंकि हमें ये पता ही नहीं चलता कि ये जगह भी है जिसमें हमको ब्रेस्ट कैंसर रिलेटेड लिम्फेडिमा रहता है. ये सूजन हम ब्रेस्ट कैंसर के बाद हमको यहाँ पे आती है. और मैं बहुत एक छोटा सा किस्सा बताना चाहती हूँ जो मेरे से रिलेटेड है, कि जब तक कि मैंने ये कोर्स या सर्टिफिकेशन, या मैं सर्टिफाइड लिम्फेडिमा थेरेपिस्ट नहीं हुई, और मेरे जो ट्रेनर थे किरण शाह करके, और ये जो लिम्फेडिमा सर्टिफिकेशन था, ये पहली बार इंडिया में हुआ था, और वो ऑर्गेनाइज किया था इंडियन लिम्फेडिमा फाउंडेशन ने. आई वाज वेरी फॉर्चुनेट कि मुझे हुआ. तो मेरे एक कुछ कंप्लेंट्स थी, और मेरे को कभी नहीं लगा था कि ये लिम्फेडिमा के कारण होगी. मेरे हाथों में तो कहीं लिम्फेडिमा नहीं है, पर मैंने जब मेरे ट्रेनर को बताया, और उन्होंने बताया कि ये तो दिस इज ट्रंकल लिम्फेडिमा, ये बॉडी में हुआ है जो लिम्फेडिमा है. और जब उन्होंने मेरे लिए वो मैनुअल किया जो लिम्फेडिमा ट्रीटमेंट में होता है, दूसरे दिन एब्सोल्युटली मुझे कुछ डिफरेंट फील था. ऐसा नहीं था कि मैं बहुत अनकंफर्टेबल थी. तो ये होता है कि जो ट्रंकल लिम्फेडिमा रहता है, ब्रेस्ट को, चेस्ट को और पीठ को, ये अननोटिस्ड होता है. और जब लिम्फेडिमा की बात करते हैं, तो हमें ये मालूम रहना चाहिए कि ये लिम्फेडिमा होता क्या है और ये क्यों होता है, और ये बाकी इडिमा से, यानी बाकी स्वेलिंग से, हाउ डज इट डिफर दिस लिम्फेडिमा फ्रॉम द अदर लिम्फेडिमा. बेसिकली लिम्फेडिमा ये एक कंडीशन रहती है जिसमें त्वचा के नीचे, बिलो द स्किन, और हम बहुत स्पेसिफिकली बोलेंगे तो इंटरस्टिशियल स्पेस, यानी टिश्यू स्पेस जो रहती है, उसमें हम एक एबनॉर्मल कलेक्शन होता है, एक्यूमुलेशन होता है फ्लूइड का. और ये जो फ्लूइड रहता है, ये बहुत ही पिक्यूलर रहता है, उसी को लिम्फ बोला जाता है. ये फ्लूइड बाकी फ्लूइड से, जो सूजन आती है उससे बहुत अलग रहता है. इट इज डिफरेंट देन व्हाट कलेक्शन यू हैव इन इडिमा, डिफरेंट इडिमास. दिस कलेक्शन हैज गॉट वाटर as one component, protein as a second component, fat and cellular components. सेल के जो भी डेब्रिस रहता है, और उसमें जो टॉक्सिन्स रहते हैं या वेस्ट प्रोडक्ट्स रहते हैं सेल्स के यूज के बाद के, वो इसमें पाए जाते हैं. तो ये जो लिम्फ रहता है, तो हमने ये जानना बहुत जरूरी है. जब ये लिम्फेडिमा क्यों होता है, ये आप समझ जाओगे, तो आपको उसमें जो मैनेजमेंट होता है और उसका जो केयर होता है, वो क्यों होना है और किस लिए होना है, ये बिना कुछ सोचे ही समझ जाएगा आपको, और आपको हर बार के लिए याद रहेगा. क्योंकि मैं हर बार सोचती हूँ कि जो चीज आपको याद रखनी है वो आपने समझ ली, तो याद रखने की जरूरत नहीं रहती है. हमको वैसे ही पता रहता है कि वो क्या है. तो जैसे
Sorry,
हमारे शरीर
so now can you say the same thing in English as well? So
या
maybe you should just say in English and then maybe we do a summary in Hindi or something like that. Yeah.
So this particular swelling has got the components, as I have told you. You must have understood that it has got water, protein, cellular components, and fat. And this makes this edema different than the edema what you see swelling what you see usually. And then to understand this, suppose you know why it occurs, what is the lymphatic system, and what happens during breast cancer surgery. स्तनों के और कैंसर के बाद में जो हमको ऑपरेशन होते हैं या ट्रीटमेंट होती है, तो उसमें क्या होता है, अगर ये हमारे ध्यान में आ गया, तो we would be very well able to know why it happens and what care we should be taking. And but naturally you would understand it better. Once you understand it better, you would be able to apply it in your lifestyle. You will be able to make the changes in your lifestyle. So to understand this, you should know that we have got a circulatory system which contains arteries and veins. So arteries और वेन, ये दो चीजें रहती है जो हमारे शरीर में ब्लड का एक सर्कुलेशन करती है. So arteries, they take the blood from the heart, receive it, and then they distribute it to the different tissues. हमारे अलग अलग मांसपेशियों में ये खून बहता है. और यही कहीं जब आर्टरी का एक छोटा हिस्सा रहता है कैपिलरी, उसके जो सेल्स रहते हैं उसमें से ये ऑक्सीजन सप्लाई होता है हमारे पेशियों को. the oxygen supply and the nutrition is being given out in the spaces of the tissue. And this, what happens is, after it is being used, it should be taken back into the circulation. ये कहीं जो बाहर निकला है उसे हमको वापस लेके जाना है हार्ट की तरफ, तो वो काम करता है वेन्स. पर यहाँ जो हमको अंडरस्टैंड करना है, समझना है, that only 80% of fluid what is being given out is veins are able to take them back into the circulation, and 20% remains in the tissue space. जो 100% बाहर निकला है उसमें से 80% वेन्स लेके जाती है, 20% तो वही है, और ये 20% जो है क्लियर फ्लूइड, यही है लिम्फ, जिसका मैंने आपको पहले कंपोनेंट बताया. I have told that component, what are the components of lymph, and this is what is lymph. And to take away this back is what lymphatic system does. And why it doesn't go in veins or venules, why it doesn't go back in that route? Because the molecular weight of these substances and the toxins and the cellular waste are more, and then they are not being able to take back into the veins. So this lymphatic system carries this lymph, which contains whatever components I have told, and then it goes, the lymphatic channels, they go and they reach the lymph node, which is one of the component of the lymphatic system. And then this lymph is being filtered there, filtered for the infectious material, filtered for the toxins, filtered for the waste material, and then it goes back into the circulation. Right. So this is, in short, you should know how the lymphatic system differs and what happens, and why. Once I tell you what happens during surgery and treatment, now that you know what it is, how it is, you will be able to understand why it is happening, right? So after you know what is lymphatic system, you should be knowing that how much at risk a person is. We know that every breast cancer survivor is at risk of developing breast cancer related lymphedema, but generally it is said that 1 out of 5 breast cancer survivors are at risk of developing breast cancer related lymphedema. And overall percentage of breast cancer related lymphedema is somewhere between 20 to 56% in India. And it depends upon what treatment you had for the breast cancer. For development of breast cancer related lymphedema, it is very important to know what kind of treatment you are getting, whether it is modified radical mastectomy, or you have undergone a breast conservation surgery, whether you had a axillary, this is axillary, यानी ये बगल में जो lymph node रहते हैं उसको निकाला गया है क्या, आपका स्तन पूरी तरह से निकाला गया है क्या, या आपका स्तन जगह पे रख के सिर्फ उसमें से वो ट्यूमर निकाला, जिसको बोलते हैं ब्रेस्ट कंजर्वेशन सर्जरी, यानी ब्रेस्ट उसी जगह पे है, ब्रेस्ट नहीं निकाली गई है, और कोई कोई पेशेंट में पूरी ब्रेस्ट निकाली जाती है। और sentinel lymph node biopsy, that you inject a dye inside the breast, which is a colored dye or a radioactive dye, and then you find which are the lymph nodes which are taking the dye first. और उसमें से पूरा lymph nodes बगल में से निकालने के बजाय हम पहले सैंपल लेते हैं और उसमें देखते हैं कि हमारा कैंसर वो lymph node में गया है क्या. If suppose we find that sentinel lymph node biopsy is showing the cancer to be spreading to those lymph nodes, then the decision is being taken whether the axillary, यानी यहाँ के बगल में के सारे lymph nodes या जो possible है, level 1, level 2, level 3, that how many what are to be removed, it is different. So देखा जाता है कि something had been popped by the
sorry,
circle. Yeah. So modified radical mastectomy में इसका incidence ज़्यादा है, 25 to 50% chances हैं अगर आप modified radical mastectomy हुई है, और अगर आपकी breast conservation surgery हुई है तो कहीं आपकी risk, you are at risk for 5 incidence would be 5 to 30%, and if suppose you have undergone axillary lymph node dissection, your risk is somewhere incidence of having lymphedema is 10 to 20%. And that of sentinel lymph node biopsy, previously long time, decades back, it was said that if suppose you have a sentinel lymph node biopsy, you are not at risk. No, with sentinel lymph node biopsy also you have got 5% chances of developing lymphedema. So it depends, and also it also depends whether you had a radiotherapy, whether you had it onto the breast or you had it to the regional lymph nodes. आपके बगल में लाइट दिए गए हैं क्या, या आपके चेस्ट को लाइट दिए हैं क्या, ये सब बताता है कि आपकी रिस्क क्या है. वैसे ही आपका वजन, डायग्नोसिस और ट्रीटमेंट के समय आप ओवरवेट थे क्या, whether you were overweight, whether your BMI was more than 25, or you gained weight after the surgery. So overweight also puts you on an additional risk of developing lymphedema, whether it is any other lymphedema or breast cancer related lymphedema. So your risk always increases if suppose you have overweight. So there is one more chance, a reason that you should be keeping your weight under control. And then once you know that it is what is lymphedema, what are the components of lymphatic fluids, how you are, you are at risk of developing lymphedema. Here, it happens that when you are going in for the surgery, the surgeon cuts through the breast, and 75% of breast lymph drains into the axillary group of lymph nodes. 75% ये यहाँ का breast में का lymph जाता है बगल के lymph nodes में, और वैसे ही हाथ का भी उसी में जाता है. तो ये हमको समझ जाता है कि अगर breast में lymph node में lymphatics में कोई problem होता है तो यहाँ का भी drainage affect होता है. So drainage from the breast and drainage from the upper extremity is somewhere disrupted. It is the continuity of the lymphatic is not there, and that is why the flow of lymph to the central circulation is hindered, and that is why there is a collection. The surgeon, when he operates, he cuts through the lymphatics and they are removal of lymph nodes. तो यही कहीं ये होता है कि lymph nodes ही नहीं है वहां पे, तो ये कहाँ जाके drain होगा, कहाँ filter होगा, और फिर lymph node से कहीं आगे जाएगा. How can it be that the lymphatic fluid goes into the lymph nodes, they are filtered and then going back? So this pathway is somewhere interrupted, and it doesn't happen that the lymph goes directly. But then if suppose this is happening, the lymph doesn't go directly, we have to find out the way how it can be rerouted to the normal lymph nodes, and there where the management of lymphedema comes. So again, one thing for prevention or early detection, as I told, before you go under the knife or you go for the surgery, आपका operation होने के पहले जिस तरफ आपको कैंसर हुआ है उस तरफ के हाथ का मेजरमेंट लेना जरूरी है. अगर वो मेजरमेंट नहीं होता है, suppose you don't have the measurement of the hand or the limb on the side you have been affected by breast cancer, then but naturally you would be comparing the measurement or circumference of that upper limb with the normal or unaffected side limb. But then it is always better that the measurement of the limb before the surgery should be taken, and then the serial measurement should be done so that you have an early detection. So I think this makes clear what happens during the surgery, why the lymph vessels are disrupted, what is lymph, and why lymphatic system is important for us. And then we should be going in for what are the early signs and symptoms of lymphedema. Though early signs and symptoms of lymphedema are very important, they are, you may get a tingling, a numbness of the hand, and then tingling, numbness, fullness, heaviness, and then you may have increase in the circumference of the hand. So this should be noted that if suppose you have a tingling numbness, your there is a swelling of the hand or the arm, your uh, ring gets stuck up, or your watch is tight, or your sleeves are getting tight, this you should be knowing. And then the clothing or the jewelry what you wear sometimes becomes tight. The shoulder movement is painful. Most important, the complaint the patients they come with is, मैडम मेरा ये ब्रा का जो स्ट्रैप है ना, ये कहीं मुझे बहुत गड़ता है, digging off the breast strap. But then people, they are not able to know that this could be the early sign or the first sign or the presenting symptom of truncal lymphedema. If suppose a lady is wearing a low band and then she suddenly sees that एक तरफ का मेरा पीठ का हिस्सा बाहर निकल रहा है, scapulary region is something which is bossing out. It is nothing to do with the surgery, because they are made to understand that yes, it is because that you have undergone mastectomy, there is some scapular dysfunction. Yes, there is a scapular dysfunction, but then this bossing out of that part is due to the collection of the fluid there, the lymph fluid there. This is because of the truncal lymphedema which is seen. And also if suppose a lady observes herself at the area of her waist, she would find an additional skin fold which is not there on unaffected side. This is also one of the signs of lymphedema. Skin gets bit loses its elasticity, the movement becomes difficult, there is a shoulder pain. These are the few signs of lymphedema, and movements of the limb becomes difficult. So once you know what are the signs and symptoms, it is very easy for you to know anything of this happens, anything deviation from what was normal for you, you should be seeing your certified lymphedema therapist or your oncotherapist, who would be referring you to a certified lymphedema therapist, who would be a proper person to advise you what should be done at that time. And then if suppose you reach in time, then your disease will not progress from a latent phase to a phase which is stage is called third stage. Latent phase, phase 1, stage 1, 2 and 3. Third stage, when you have a huge limb size, you have a thickened area, you are more prone for a local infection, because one should understand that this fluid, lymphatic fluid, is protein rich, and protein is a thing which facilitates the bacterial growth. So any injury to this part and infection setting in, then that is a fulminant infection. So this is what has to be taken care, and that where it comes what should be the care to be taken or the precautions to be taken for lymphedema. First and foremost of it is the skin should be kept dry. The skin should be kept dry and it should be kept clean. But the cleaning and dry, you should not be very rough, and it should be a very gentle cleaning, gently making it dry. after every wash, you should moisturize your skin, and moisturize with a low pH solution. It is effect of P. What is that? What I advise my patients to, because it is easily available. It is economical also, because so many patients, बहुत सारे patients जो रहते हैं वो पूछते हैं कि मैडम ये तो हमको मिलता नहीं है, दूसरा उनका प्रॉब्लम रहता है कि ये जरा ज्यादा महंगा है मैडम, हम तो ले ही नहीं सकते हैं. But then it is not like that. Effect of P is a thing which is इकोनॉमिकल, उसका बहुत कीमत भी नहीं है. और हाथ और स्किन बहुत क्लीन रखना है, उसको सूखा रखना है, और बहुत अच्छे से ध्यान देना है कि अगर आपका हाथ बहुत ज्यादा मोटा हो गया है, ज्यादा उसका साइज बढ़ गया है, if it is more swollen, then your skin folds or ridges are deepened. So you have to clean between the fingers, you have to clean between the ridges if suppose it is hardened and it is more. And then one should be not wearing any tight clothing, no tight jewelries, and you should avoid any application of a BP cuff. No blood should be taken from the hand that is affected. Also, no injectables to be given. This is a simple thing what you should be doing. No massage. Why no massage? Because massage increases the blood supply, and then in turn the lymphatic fluid collection over there. The nails should be kept clean, because अगर आंख आपके नाखून साफ नहीं रखेंगे तो वो एरिया कहीं तो भी आपके इन्फेक्शन का कारण हो सकता है. ये आप जरूर समझ लीजिए कि लिम्फेडिमा जिस के लिए अगर हम एट रिस्क है तो हम एट रिस्क है इन्फेक्शन के, क्योंकि अगर सर्कुलेशन यहाँ बराबर नहीं होता है तो कहीं ना कहीं हम इन्फेक्शन के लिए प्रोन रहते हैं. We are prone for having those infection, and once the infection happens there, it is fulminant. We may have cellulitis or a fulminant infection. Any injury, कोई भी छोटी सी छोटी इंजुरी वो हाथ को होती है, any small injury, it should be treated like a major injury. If suppose you are going out, you should be always vigilant of the insects or mosquitoes there. You should have a mosquito repellent. You should wear a full sleeves. If you are working in a garden, you should be wearing a gloves. Working in kitchen, you should be wearing gloves so that you don't have a cut or burn. And if suppose you have, then you should be treating it well. And then the question is all about weight. Again, weight control. You should be controlling weight. Exercise and stretching should be in your lifestyle. And then so many times the patients, they ask me about the pressure garments or pressure sleeves, or the stockings, what you pressure stockings to be worn. But then it depends upon what is your condition. After examining the patient, then only we will be able to tell whether the pressure garments are required or any other pressure compression bandages are required. So this is what is in short what care should be taken and what precautions are to be taken for lymphedema to arrest its progress or prevent it from developing or prevent the complications which arise from the lymphedema. The complications are you may have an ulceration, you may have छाला हो जा सकता है, या कहीं छेद होके उसमें से वो lymph बाहर आता है जो बहुत irritating होता है, या if suppose the infection sets in, it can be cellulitis. So you should observe for any red patch, increase in the temperature, or itching. Any break or injury to the affected limb is very dangerous. And then, but naturally, the question arises, how are we going to treat it? How are we going to treat it? The gold standard for treatment of lymphedema is CDT. It is complete decongestive therapy. And in this complete decongestive therapy, which is, it is including so many components, multi-component therapy, and it includes manual lymphatic drainage. Manual lymphatic drainage, or MLD, is a procedure which is soft, gentle, manual manipulation of the tissue and superficial lymphatics. These superficial lymphatics are few millimeters deep, either 3 or 4 millimeters deep in the skin, and these are manipulated by gentle, soft manual. And so many people, they misunderstand it with massage. No, not absolutely not. Manual lymphatic drainage is no way massage. It is a soft, gentle, manual manipulation of the tissues and the lymphatics so as to reroute the lymphatic fluid. We can, if suppose my right hand side is affected, I have to reroute it to the normal left hand lymphatics, or we reroute it to the inguinal group of lymph nodes, या ये जो पैर के पास के lymph nodes रहते हैं वहां पे एक तरफ से सामने से भी हम इस तरफ लेके जा सकते हैं और पीछे से भी. So manual lymphatic drainage ये नहीं सिर्फ पानी का कंटेंट यानी water, it also helps us to reroute the cellular components, reroute the protein also. So it is somewhere, it really helps us to get to reduce the size of the limb, to reduce the lymphedema. And then the component is compression therapy. And then why compression is required? If suppose you have a lymphedema, because of the collection or accumulation of those lymphatic fluid, the elasticity of the tissue is gone. So once you empty it, right? But then it doesn't mean that only one session if everything is empty. It should be over a period. It depends on how much is the lymphedema. Then we decide how many sittings that patient is able to have, and then we teach them how to do a self lymphatic drainage, and then it should be over the lifetime period that they should be taking care of it. And then compression is applied with a proper bandage, not a elastocrate bandage. It is a special type of bandage, and we do the bandaging, and later on we may give an option to the patient to wear a compression sleeves. And then comes a decongesting and breathing exercises, which also plays a very major role because our circulatory system has got heart to pump. हमारे सिस्टम को एक पंप रहता है जो हार्ट है, वो हार्ट में से फ्लूइड ब्लड पंप करता है और सर्कुलेशन में जाता है. पर लिम्फेटिक सिस्टम को ऐसा कोई पंप ही नहीं है जो लाए और उसको फिर से पुश करे. तो हमारे जो मसल्स रहते हैं, ये मसल्स के बीच में ये लिम्फेटिक्स रहते हैं. जब मसल कॉन्ट्रैक्ट होते हैं तो ये एक पंप का काम करते हैं. दे वर्क एज अ पंप टू द लिम्फेटिक्स. दे help the lymphatics to propel the lymphatic fluid forward. So that is what these muscles, they act as a pump to the lymphatic system. तो अगर हम ये muscles को काम करेंगे, ये muscles को stretch करेंगे, तो कहीं ना कहीं ये lymphatics को काम करने में मदद करेंगे, जो भी lymphatics available है. जब हम ऑपरेशन करते हैं तो ऐसा नहीं कि वहां से सारे गायब हो जाते हैं.
Sorry, doctor, I do have to tell you that, I think we'll need to move on a little faster because there's a lot of questions also.
This is now end of it.
Right.
And
okay.
then
Sorry.
Then is skin and nail care, which I have already told. So this completes what is lymphedema, how to take care, what are the signs and symptoms, what are the care and precautions, what is the treatment, and what is the management. I think that is in toto.
Right.
Thank you for giving me the time to tell everything.
No problem. No
that
problem.
Yes, one who is listening should know everything.
Sure. Understand.
So, yeah. So
just for people who are watching, if you
exercises.
haven't, sorry, just for people who are watching, if you haven't yet answered the poll, please do so. That just helps us understand the audience better. And I'll launch one more poll. So if you finish answering this one, I'll just do the second one. Okay. Do you want to do?
Should we move on for the exercise?
Yes, please.
Quick exercise thing.
Right.
What we have to do. So we have with us Keka, as it has been told, and she's Keka. She's Hello. Keka, my friend.
Hi, Keka.
Hello. Good evening. And she is also a breast cancer survivor. 2 years she's going to complete. And she is very meticulously doing the exercises. So let's go directly without wasting time so that we can have a lot of interaction. So first and foremost is the abdominal breathing exercise. She is demonstrating how to do the abdominal breathing. Sometimes the patients find it very difficult. When you breathe in, it should be abdominal, the abdomen should come out. And then when you put it out, it should relax. Not exactly going in, but then it should relax. So this to begin with, possibly 5 times, and then increasing to 10. But then always remember, it should be slow. You should have your own pace. It should be slow, no jerky movements. Absolutely. And whenever you find any pain or discomfort, stop at that moment. Second comes is we have to have neck lymph nodes or lymphatic stimulation, and that is shoulder shrugs. The shoulder shrugs first and foremost is neutral and going up. And mark it. It's only the shoulder which are moving. Very slow movement, taking it up and very slowly coming down. No hand movements with it. The second type of shrug is the neutral and going down. Neutral, shoulder movement, not shrug, neutral and going down. This also to be done very slowly with your own space. Any discomfort, pain, stop. And then is retraction of your shoulder behind. Slow and go behind. And come to the neutral and go behind. To begin with, 5 repetitions, and later on take you should aim at making it 10. But then again, remember, slow, take your own pace, go at your own pace, and if suppose you have pain or any discomfort, stop. Then comes the arm raises. This somewhere stimulates or activates the arm axillary lymph nodes. Very slow, look at the thumb, which should be pointing up. Slowly she goes up, clinches her fingers, and slowly she comes down. That slow it should be. And again she clenches it. This is very important because clenching of fist activates or makes your forearm muscles work, and there where it works for the lymphatics in your forearms. Next is biceps exercise. Biceps is a muscle of your arm and it surrounds the lymphatics there. Very slowly you contract, you take your arm, curl your arm, clench it, and again bring back. All exercises to begin with 5 times, and then your aim should be making it 10 times at a sitting. Then is a triceps exercise. Slowly you have to take your arm up, support it with your other hand, and now extend it up. Again clench your fist and go down. Absolutely slow. Any discomfort, pain, stop at that very moment. Then is again clench your fist. So 2 times you are making your forearm muscles work. Now is side arm raise. Very slowly you raise the arms. And then bring it down. As I've already told, to begin with, all exercises 5 times, and then make an aim to go up to 10. If you're not able to totally take the hand up, please don't struggle, don't force the hand which is the unaffected side. Whatever you're able to do it till that range. The normal hand should also be with that range, and then later on slowly it can go up. And then is the finger wall climbing. With this again, you are mobilizing. With this, you are mobilizing the shoulder. As your hand goes up, go near the shoulder. I'm so sorry, this is not being able to demonstrate properly, not seen properly because of the video. I'm so sorry. Yeah. But then this is to be done 5 times. As the hand comes down, you have to move away from the wall. Slowly. This is to be done 5 times. And then it has to be increased. Then is bicycling of the hand. This has to be done, and the attention is to be taken that your elbow should not be going out. Initially, Keka had to work on it because her elbow was, she's also affected on right side. Elbow was going out, elbow should not be going out. So it gives the moment of full arm and shoulder 5 times to begin with, and then making it 10 times. And one, if suppose one is not able to, can take the, see, this way also one can do. If one is not able to, initially you can do this, and later on you can do without the support. This brings us to the end of the all exercises, but then before we end exercises, again repeat the arm raise, the shoulder shrugs, arm raise again, and when you are doing it at the end of it, do it 5 times, because you're revisiting the lymphatic channels and the lymph nodes. Then is a shoulder shrug, up, down, and then retraction. Everything to be done in a slow pace, and whenever you have pain or discomfort, stop at that very moment. Don't force, don't stretch yourself too much. If you're not able to, please be patient with yourself. It's your body, understand the body and the pain the body has. And then again going back to the abdominal breathing. This is very important. When you breathe in, this is an abdominal breathing, breathe in, the stomach or abdomen should come out. When you breathe out, it should relax and it should be going. So this is what it is. 11 times, I think 1 hour, that is a very fast exercise explanation.
Thank you, friends. Only 2
Thank
points
you.
to remembering. We have to do it at our own pace, and we have to be very, very considerate towards the arm that is affected. Thank you.
Thank you, Kate.
Rohini, how often does a patient need to do this? Just once a day?
See, to begin with, it should be once a day, and later on, we should aim to do it twice a day. It's always better to do twice a day.
And can they start doing this soon after the surgery?
Yes, once the stitches are out and you don't have pain, you would be. The wound is completely healed. Yes, you can start the exercises, and it's always better to start it early. Because so many times we see that patients, they complain they have got a restricted shoulder movements. I had restricted shoulder movements because my physiotherapy or exercises were not started early, and then it was very difficult for me to have a full range of shoulder movement. So it should be started early, as soon as the wound is healed totally and the oncologist says that yes, your wound is okay, you can go for the exercise.
So even if you don't have any symptoms or signs of lymphedema, you should still do the exercise.
These are the preventive one.
Okay.
Preventive one too. You know, it can help in the drainage, rerouting the lymphatic, that has to be done.
So lymphedema could be like, is it reversible in initial stages, or we can just arrest it by doing exercises?
Yes, it can be reversed back to near to normal. If suppose it's in a very early stage, yes, we have seen patients, their limb size absolutely comes down to normal. Keka had initial lymphedema, now both hands are same. And we had seen a 6 kg hand with so much of complications as fibrosis. We can revert back near to normal. If suppose it is in quite advanced stage 2 or so, yes, we can, but then it takes time. One has to be patient, but then the limb size does come down near to normal.
Thanks. And second thing I wanted to ask you was, where exactly does it pain in the shoulder? Like, is it possible that we are mistaking it for something else, or we are mistaking it for lymphedema and it is something else?
Oh, in that case, you should get yourself examined by your certified lymphedema therapist as well as the orthopedician. Then only we will be able to know. You know, because shoulder pain with each and every patient, the shoulder pain differs.
Right. Okay. Thanks.
I think I'll take a few questions that have come in as well. I have lymphedema only in my hand as of now. Since 2 months, it has not progressed or improved. I finished my treatment about a month back. lumpectomy was done about 6 months. Full axilla was removed. What should I do?
Yes, you should be contacting a certified lymphedema therapist who would be doing a manual lymphatic drainage for you and would let you know what are the exercises you have seen that you should start doing it, and also the manual lymphatic drainage. It's if suppose it's just fingers what you are seeing and it's not the whole hand which has been affected, I feel that yes, it would be reverted back, reverse back very soon.
Right. I think somebody asked, is it related to the number of lymph nodes removed? Are the chances of
Absolutely, yes.
developing lymphedema? Yeah.
It depends on how many lymph nodes. As I told you that the lymphatics, they drain into the lymph nodes, and the more the lymph nodes are removed, more the interruption in the lymphatic channel. So absolutely it happens that if suppose more lymph nodes are removed, yes, you have got more disruption and more hindrance of the lymphatics to flow. So it is self-explanatory.
Right. Can we apply talcum powder and do manual drainage?
Manual drainage, but then that has to be taught to you. You know, the pressure which has to be exerted, it should be very specific. If suppose more pressure is applied, the superficial lymphatics, they get damaged, and in turn getting benefited, you would be harming yourself. So nothing to do on your own.
Right, right.
Because
I think there are some requests, sorry, for certified lymphedema therapists. I'm just going to ask, and if anybody knows on the group, please answer. And if you want, you can raise your hand. People have requested in Jaipur. People have requested in Hyderabad and Bangalore. So
yes, I can help them in the way that they should be going on Indian Lymphedema Foundation website, and there they have listed the certified lymphedema therapist for all the regions.
Okay, so we'll add that in the show notes kind of later as well, the link to the Indian lymphedema
website.
Right, okay.
I request that everyone who needs to know should go to ILF website, and they do have, and if suppose they don't have, you should put your request there, they would be letting you know.
Okay, thanks. When I do exercise at times, my affected arm perspires much more than the other hand. Is it normal? And also, doctors say don't lift weights over 5 kgs.
Oh, this is something to be told. It is always been that no weightlifting and no heavy thing. But no, weightlifting, it was initially said that no weightlifting, but then you can be doing weightlifting, but then it should be initiated very slowly, progress very slowly, and depending upon your capacity. If suppose you have never done that, you should know what your capacity is. You should not exceed your capacity. That the trainer or the certified lymphedema therapist will be able to tell you. But then I am doing weightlifting since I have been diagnosed after that. But then it has never caused my lymphedema to appear because it was initiated and progressed gradually. Gradual, if suppose you are holding 1 pound, then 2 pounds, it should be gradual, and you should listen to your body. What is the capacity of your body? Then it doesn't harm. And the sweating, yes, that has been reported, but then it's nothing to do with that.
Yeah, we also have in this group Shilpa, who has, who's contributed to Patients Engage, and also she is a fitness trainer, so she does workouts with weights, and she thinks that maybe it's the reason she doesn't have lymphedema.
Yes, Shilpa. It's suppose Shilpa is there online. Yes, Shilpa. It is true. I have been doing the weightlifting, and so many times people ask that should we wear the compression sleeves when we are doing gymming. But then if suppose you don't have lymphedema, and but naturally your tissue elasticity is good, you need not be wearing. Why? Because the compression sleeves over the skin, below that is the muscle, and when you work out, it contracts, and the pressure exerted on the superficial lymphatics, above is the compression, below is the muscle, and these lymphatics, they get damaged. So if suppose you don't have, you are not needed. Initially they used to say that you should always wear, but now it is that you should not wear. Only thing is that if you have a well-established lymphedema, you should be wearing compression sleeves. because it will support your tissue which has lost the elasticity. Shilpa there?
So on the compression cloth, somebody's asked, when the compression cloth is worn, the swelling increases. Is it advisable to wear compression socks and hands?
So then I think then they are not proper fitting. If suppose the swelling is increasing, they are not proper fitting.
Okay.
Yeah, I
Sorry.
wanted to ask you.
Go ahead,
Yeah,
Kurvi.
doctor. Yeah, that I've heard that we need to wear the compression sleeve while air traveling. Is it true?
Yes, yes. Because the the cabin pressure is something less than what we have the atmospheric pressure outside, and then that is the time that the gravity also supports our tissue, and that support is gone. So the effect is you can be having accumulation of the fluid. So it is always said, but the class of the compression stockings should be told by the lymphedema therapist. Because people just go and buy it and then doing otherwise the way they shop and they come and wear it and then it's too tight and then they are not able to wear it. They are very uncomfortable and they leave it, but then it is not like that. Depending upon your limb, the compression stockings are advised.
I think it's prudent to say that before a patient embarks on any lymphedema exercise or buys any products, they should actually meet with a therapist, a physiotherapist, or a lymphedema instructor first.
Absolutely, absolutely.
One question on laser hair removal or waxing. I had started permanent hair laser removal, but stopped because of lumpectomy and 4 axillary nodes removal. Not malignant though. Can I do cold waxing / laser hair removal again?
You have to be very particular. All aseptic measures are to be taken, but then waxing, because the upper layer also sometimes gets peeled off, so it is very dangerous. It may lead to some breakage of the skin there, and then the infection may go in. So any procedure which would put you on risk of having some discontinuity in the skin, you should not do it.
Also, I was asked to do bandaging, but due to hot flushes, I had to discontinue. Sorry. What should I do?
No, with hot flushes are not going to last for long. And yes, I know, but then you can be doing one thing is when you're doing bandaging, you should make that bandage bit cold, and then should be applying, or you should be taking care that you should be changing it. You learn how to do it. When it gets wet, you can again remove it, because you cannot afford to have the lymphedema. You can afford to change it, the bandage, and learn to how to do it, but then not that. Once you are having a lymphedema, it progresses, it's really miserable.
Right. Sorry, keep going ahead, and I'm just looking through the questions that have come so that we can.
And one more thing, so many times the patients, they ask me that what kind of bra? Yes, bra with any broad strap, and you should be having a pad there, padded support to the straps, and no underwire bras.
Okay. Can we do normal activities like making chapatis? Also, when I do somebody else related question, when I do household chores, my lower arm starts showing small swellings. After a certain time, it goes eventually. Does it indicate early lymphedema?
Yes, it can, because the stage 1 lymphedema is a reversible lymphedema. It goes overnight, but then you should be seeing the lymphedema therapist and know and how to do a self-lymphatic drainage you should be doing, and whether you are advised to use compression stockings while doing the work. When you know that you're doing making chapati, ghar mein kuch bana rahe ho aur aa raha hai, so there was somewhere the elasticity is less, and there is a place to accumulate the fluid there. Or your whatever lymphatics are available, they are overworked and they are not able to cope up with the lymphatic load, whatever it is there. जितना lymph तैयार हो रहा है उसके लिए वो काफी नहीं है वो lymphatics.
And that's the same as somebody saying there's a swelling in my wrist and fingers, but soon it disappears. Please let me know the reason.
Absolutely, that can be early sign, but then they should be taking an opinion of. They should be taking opinion of certified lymphedema therapist.
Because it is one of the signs of side effects of hormone therapy too.
Hormone therapy, right. So many people, they blame, not blame actually, they say that chemotherapy also puts us on high risk for lymphedema, and hormonal therapy. Anything which makes you retain water makes you a bit more at risk of it.
No, I think what Urvi was trying to say is those symptoms of swelling in the fingers, etc., can also relate to hormone therapy.
That is water retention. That is water
right,
retention.
right. It's been
also put you at risk of developing lymphedema.
Right. It's been a year and 2 months since I'm operated of breast cancer. Is there a possibility that even now I can get lymphedema? I mean, obviously, yes. This means the person hasn't yet got it.
No, not like that. I think she didn't hear. I said that whether it can be. I've seen a person having, after 30 years of surgery, having a lymphedema. You can have anytime. You have a lifetime risk of developing a lymphedema. It's a lifetime risk. It is not that you didn't develop in 1 year. I didn't develop for 18 years. That doesn't mean I will not develop. Yes, I will be. I am at risk of developing it. I can develop. So I have to take precautions. So many times patients, they say that, ma'am, suppose we are taking the therapy, but then still it will not go and we have to take. Yes, I always tell them, if suppose you have a diabetes, you have a hypertension, you have a thyroid problem, you take the medicines lifelong. It is not that you take it for 8 days or 1 month and you stop it. So right. Same way, you have to maintain, if you want to be comfortable, you have to have that in your daily routine.
Right. I had mastectomy last May 2019, but still have pain, sometimes very bad pain, and sensitive feelings still remain.
Where? Pain where?
Yeah, I can't see anything. We'll wait for her to come back on that. Somebody says I got lymphedema after 6 years. Okay. Yeah, somebody's okay. Nandita is asking, you mentioned radiation leading to it. Is that?
Yes, I told the radiation leading to it. The cause is this radiation causes fibrosis of the lymph nodes and the vessels there, and they were disrupting and interrupting the flow. And that's why the radiation also predisposes us to have a lymphedema. It is not a mechanical disruption, not cutting of those lymph vessels, but yes, it is a disruption because they are not functioning because of fibrosis, the lymph nodes and the lymphatics.
Right. Can sleep postures lead to lymphedema?
If suppose you are sleeping and putting a lot of pressure and for a long time, but naturally the flow is somewhere hindered. But it is not that because you slept like this that then only you are going to have a lymphedema. It is not like that.
Sorry, okay, there's a question you've asked about a friend whose treatment is discontinued because of lockdown. It's not clear whether, it seems like the last chemo has not been done, but I think she should stay connected with her oncologist and figure out when she should go ahead with her treatment. So I think this is a very specific question that she should discuss with her oncologist. So yeah.
Absolutely, she should discuss with the oncologist and depend where she is located. If suppose she shows her, she's not in a red zone and going to a green zone, that is something different. But then they do, police and the authorities, they do permit to go for the treatment.
Yeah.
So patients are coming.
Correct. So it depends on where, but yeah, chemo is continuing in a lot of places. You mentioned a lotion or a moisturizer. Sorry?
Low pH moisturizer.
Okay.
If at top P.
Okay, we'll put it up again in the notes.
Yeah.
How much lympha press helps?
Lympha press, one has to understand that lympha press presses only the water content out. It doesn't address the cellular component and the protein. You get immediate result. The lymph shrinks and the same rebound again because this protein and the cellular components again pulls the water back. That is what it is. So that's what I told that gold standard for the lymphedema treatment is CDT, complete decongestive therapy.
Okay, here's an interesting question. Can the opposite unaffected side also get lymphedema due to lymphatic load imbalance?
No, they have a normal lymphatic and normal, suppose they are having a normal lymphatics and the lymph nodes, they would be able to cope up with this.
Okay. Is it advisable to wear silicone bra pad for longer time?
Longer
Probably
time,
not.
a day or your
Yeah, it's not clear.
lifetime.
So,
Is it advisable to get surgery for transplanting lymph nodes?
Yes, it is nowadays.
It is now
Yeah,
commonly done.
but then yes, it should be through the skilled surgeon who's known for doing it. They do have the lymph node transplant and the anastomosis of the lymphatics. The microsurgeries are being done, and yes, these are something which is coming up nowadays.
And it's done at the same time?
Hmm?
Is it done at the same time, or is that a separate surgery?
It is a separate surgery sometimes, and sometimes it is done at the same time.
In India too?
They do the surgery at that time. Anastomosis is being done with the veins and the lymphatics. The lymphatic also.
sorry, I think Urvi was asking something.
Yes, Urvi?
Yeah, I was asking that is it possible in India too, that were the ongoing?
Yeah, there are some few centers which are.
Okay, thanks.
And somebody asked, can we learn MLD online?
Self-lymphatic drainage, yes.
Okay.
But then it is always better, because if you do it once and you never know when you drift apart from what it is required, there should be monitoring, always monitoring should be there. The pressure which is applied, unknowingly you drift from what is required. So there should be consultation and surveillance. And the Certified Lymphedema Therapist, you should be doing it. You never know when you have started doing something wrong.
Right.
डॉक्टर मुझे हिंदी में एक मैं स्पेसिफिकली पूछूंगी बिकॉज यू टॉक्ड अबाउट द वेट एंड ऑल सो वजन ज्यादा उस टाइम पे ड्यूरिंग द सर्जरी ज्यादा है तो ज्यादा चांसेस है या फिर लेटर ऑन यू इफ यू पुट ऑन तो ज्यादा रिस्क है ये थोड़ा क्लैरिफाई कर दीजिए।
यही मैंने बताया था कि अगर आप जब आप ऑपरेट हो रहे हैं तभी भी अगर आप ओबेस हो या आपका बीएमआई ज्यादा है या उसके बाद आप वेट गेन करते हैं, दोनों भी आपको रिस्क में डालते हैं।
बोथ द थिंग्स, ओके। Thank you.
Yes.
And the question on the bra, they said, can you remove it while at home?
What?
She asked whether she needs to wear the bra all the time. So she meant during the day, or can she remove it at home? The silicone padded bra.
After coming back from her working place, yes, she can, but then she should be, for how many hours? Because not only it's for a physical appearance, it also plays a major role. That prosthesis plays a major role for her posture also. Because once you undergo mastectomy, one side of the breast is removed, and then there is an imbalance of the weight. One breast is there, one is not there. The weight of one breast is there, so you have sometimes a postural problem. So you should be wearing it.
Right. Okay, this is an interesting one. Is rebounding on trampoline helpful for proper lymphatic flow?
I didn't get it.
Or trampoline, you have trampoline where you can jump, bounce off. Does that help?
But then that would not be that effective. Yes, it would be causing movements of the muscles, and the core muscles would be working. But then how much it is going to be? Yes, it would. Walking in the swimming pool also helps.
Right.
Walking in the water also helps.
Right. I'm just conscious we are over our time, but we'll take a couple of more questions, and I guess my right side is affected. It remains under control with stocking. Recently, due to more pressure, क्योंकि घर का काम है, I started doing Surya Namaskar. I'm experiencing continuous pain. Is it?
Whenever you have pain, stop that. Take an opinion. Rather than that, you should be going for the decongestive exercises, what we have told, and slowly you should be going into it. And you should be going in for self-lymphatic drainage.
Right. So the person who had talked of very bad pain, I think she has clarified. Hang on, let me find.
She said that left breast was removed last May, and the pain is on the left breast area now.
Right.
Yes. Sometimes you do experience a pain because the nerve endings have also been cut through. So you do have some erratic pain sometimes, but then later on it goes. But then if it is severe and it is continuing, she should show it to her oncologist whether there is any collection or what. But then not very severe, you do have some time or other because the nerve regenerates and the cut nerve endings do have pain. But then if suppose it is really troublesome for her, she should take an opinion whether there is a collection or what it is.
So this lady who's had mastectomy in June 19, Geeta, 8 chemo, 17 transmobab chemo, etc. My right side, just below armpit, I have a lot of pain for the last 10-12 days. Consulted surgeon, had ultrasound for vein thrombosis, which was all found normal. Despite doing daily exercise of late, the pain persists. Apparently no swelling.
Oh, still, but then she should go in for manual lymphatic drainage before appearance of the swelling. If suppose you go in for it, it really helps.
Okay.
And she should see that whether her shoulder movements are normal, full range of movements she is able to do. That she should be seeing.
It's not clear. I know, Pallavi, you're asking what if both my arms affected, which means what you had bilateral and
bilateral disease, or you had bilateral removal of axillary lymph nodes, what it is.
So yes, that does happen. I mean, if you had bilateral removal, then it could affect both arms.
Yes, of course. And then too you can go in for complete decongestive therapy, because then the rerouting is towards the inguinal group of lymph nodes near the groin. You still have a chance of doing that.
Right. And how does it differentiate from general physiotherapy?
Yes, it generally general physiotherapy, and these are customized according to the individual need and what they have undergone, and how much is the swelling and what is the arm circumference. So it depends upon that how it should be done. And after that we do first the exercises are there, and then drainage is there, and then the compression bandaging is done depending upon the grade, the stage of it.
Right.
It's not generalized that everybody should go in for those exercises, everybody should have those compression stockings, everybody should have compression bandage. No, it depends on what it is.
Right. Okay. Anybody has any urgent questions? I think otherwise we've pretty much answered most of them. Anybody would like to share their experience? You can raise your hand. I'm going to lower everybody's hands and the ones who want to specifically share their experience. Okay, Mukta, I'm going to allow you to talk. So if you want to, you are, okay, you'll need to unmute yourself.
Mukta is muted.
Yeah. Okay, Pallavi, I've also allowed you to talk. So if you want, you can unmute yourself.
Hello.
Yeah.
Yeah, actually, I had a bilateral mastectomy, modified radical mastectomy in December 2019. So my both arms are affected.
Mugdha?
Hello, yeah. Can I speak?
Yes,
Sorry,
it's Mugdha. Hi.
Yeah,
this is Mukta. Okay, I think
yeah,
Pallavi just finished speaking.
yeah.
Okay,
Yeah,
yeah.
about 10 years ago, I had my breast cancer operation, and only the nodes were removed and a part of the side, not the actual breast. And then after that, that was in November, and then in June, I started getting lymphedema, that is 10 years ago, and it keeps on coming and going. And now it is about 17 on one side, my left hand, which we operated one, 17 inches, and the other side is 13 inches. So there's a gap of 4 inches. So I keep on, even I have the machine, I use it sometimes. I do exercise. So I mean, I'm quite comfortable with it. It's not that I'm not comfortable, but I do not know whether anything could happen further with my left hand, which is 17 inches. It's quite a big. It keeps on going down and up, 17 to 19, 19 to 17, like that. Yes,
Mugdha,
doctor.
Mugdha, if I'm not wrong, you are from Pune?
Yeah, yeah, I'm from Pune.
Oh,
Yeah.
hi, Mugdha.
Hi.
We had got connected with each other some time back. And yes, it must be in March we got connected. And
Yes.
this 17 inches and going to
चैतू बाबांचा फोन आहे त्यांना कर रे.
It's 17 inches.
yeah, 17 inches and coming back again 19
Circumference. Circumference is 17 inches.
yes, 17 and going to 19 and coming back to again 17.
Yeah.
And I think you should be not only those lymphopress you should be using, you should learn how to do manual self drainage. You would require that because it's very significant. It is significant.
Yeah, I do self drainage also, different ways. But even then, I mean, 10 years I've been having it on and off. Like, I mean, it is there.
Yeah, but then with age also, you should be taking more care because with age, our elasticity of the tissue goes and the lymphedema becomes severe after that.
Yeah.
And then once it is more in the circumference, the complications are more, Mugdha. So you should be more this thing only doing by yourself. I think you should be going into the lymphedema therapist, certified lymphedema therapist.
Okay.
Yeah.
Yeah. Thank you so much.
Nice talking to
Sorry.
you.
Couple of questions that I'll take from again the thing. Is it advisable to sleep on the side that has mastectomy?
Basically, compressing that limb is not advisable, but then once in a while, if you sleep, it's okay.
Right. And I think there's somebody. Okay, I think yeah, we're asking this about housework and lymphedema, but I think we've covered that already.
Hello.
Sorry, yeah. There's somebody who wants to say something. Do you want to introduce
Pallavi
yourself?
here.
Oh, Pallavi again. Okay.
Yes. I had bilateral mastectomy, modified radical mastectomy in December 2020. Sorry, December 2019. So, what work should I avoid? House chores or something else? I have 3 years child.
Yes.
I'm from Pune itself.
Yes.
Yes. So, what should I avoid specifically?
Whatever precautions and care I have told you, you should avoid that. And if suppose you're going in for any work and that is very strenuous, you should be slow and you should be slowly progressing and then coming back to your normal.
Okay. So, okay.
Yeah, Pallavi.
Thank you so much. Nothing else.
Yeah, thank you.
Hello.
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 Hi.
Yeah.
Hello.
हाँ हाँ मैम, मेरा क्वेश्चन है कि ये जो बॉल की स्माइली एक्सरसाइज होती है ना, वो कितनी बार करनी चाहिए?
To begin with 5 and then going up to 10 twice a day or thrice a day or whenever you sit you can do, but not you should not overwork your wrist.
ओके ओके. और ये मैं एलएमडी करती हूँ, मुझे अभी लिम्फेडेमा है नहीं, लेकिन मैं करती हूँ. तो मेरा क्वेश्चन है कि कभी कभी ना मेरी स्पीड बढ़ जाती है, तो इससे कुछ प्रॉब्लम हो सकता है?
Speed and pressure, those both should be very speed should be slow and pressure should be less, because you will damage the superficial lymphatics which we are going to use for rerouting.
ओके मैडम प्लीज जरा ये हिंदी में बताइए कि वो स्माइली बोल की एक्सरसाइज कितनी करनी चाहिए, कितना टाइम कर?
आप 5 से शुरू करो, 10 तक लेके जाओ और दिन में 2 बार कर सकते हो, ज्यादा से ज्यादा 3 बार कर सकते हो, पर बहुत ज्यादा मत करो क्योंकि फिर आपको कोई फायदा होने से ज्यादा नुकसान है।
ओके ओके थैंक यू वेरी मच मैम।
थैंक यू।
May I talk?
Yeah, go ahead.
I'm Nitika. I just wanted to know, suppose on the side where I've had a lumpectomy, I also, say, let's say I cut my arm, or like today I burnt my arm slightly while I was cooking. Then what does one do? I mean, the burn is slightly scraped off on my arm. What is the precaution I need to take?
Nikita, what I had told you first thing is you should avoid, if suppose you're having any small injury also should be dealt like a major injury. Please take care of it. If required, antibiotic, the dressing, everything should be done as if it's a major injury, because any dent, any disruption in the continuity would make you more of exacerbating or increasing lymphedema, or if you don't have, it will start.
So even a tiny little, it's a tiny, the skin has been scraped. There's no bleeding, but the skin has been scraped.
And then
I start off an
major
antibiotic.
injury.
I have to take antibiotic. I have to talk to the doctor for that.
You go and show to the doctors, get it dressed. Don't leave it open.
We can't go out too much. Also, that's another thing. That becomes a problem right now.
You can do it yourself in the home. Yeah. Yes.
No, I mean, I shouldn't leave it open. That's what you're saying.
No, because anything which would cause an infection to set in. So it should be. So if suppose you keep it open, there may be chances that you may catch infection there. So keep it closed, put antibiotics.
So just cleaning it with some antiseptic and then just covering it up with
antibacterial cream and then bandaging it.
That would make small. It's a small band-aid kind of thing. But just because we had this webinar, now I'm worried. I wasn't worried till now.
Don't get worried. Be just aware. Be vigilant. Don't get worried.
Okay. Yeah. Okay. Yeah. Thanks.
Take care. Bye.
Nandita, I've unmuted you or enabled you to talk.
Yeah, I like she was saying, I was not worried till now, in the sense now it's been 10 years since I finished, or rather 8 years since I finished the second time. I've had it twice, 2010 on the left side, and 2010 when I had it, they removed the nodes also on the left side. So till now I haven't had any problem. I've had physiotherapy and all those sort of things. But these precautions that you mentioned, because I do a lot of gardening and all, and I've slowly over the years, I've started taking my left hand for granted. So according to you, I should be very careful about the left hand still. I mean, the hand that the nodes have been removed. So
Nandita, you had a left side disease?
I had the left in 2010 and I had the right in 2010.
Disease?
Yeah, but in the left, the nodes were removed. And the right, the nodes, I had the sentinel node biopsy and the nodes were not removed on the right side.
Oh, but then you had sentinel lymph node biopsy, isn't it?
That is for the second, yeah, for the right side.
But then that also puts you at risk of lymphedema. But don't worry, it's my 18 years and I've been doing gardening and everything.
Okay.
So if suppose you take care.
I do. I am careful, but then I have slowly maybe started taking it for granted. Not that careful. I mean, not initially. I used to, immediately jump and sort of disinfect and whatnot. But now, okay, if I'm in the garden for a while till I get inside and all. So, but from what I've understood over this webinar is that I should be a little more careful.
Yes, it's always better to be careful.
Okay, just a clarification. Yeah.
Take care, Nandita.
Yeah, thank you. Thank you so much.
Yeah, I think we pretty much okay. I've enabled Savita, and I think this will be the last one. Sorry, we have gone well over time. So Savita Anant,
I would like to know for how long should I use the stocking? I use it since I buy it once a year. So how long a particular stocking can be used for?
Hello?
Yes, yes. Did you hear me?
Can you come again?
Yeah, I said I use the stocking and I wear it every day for 6 to 7 hours. So how long should one particular stocking be used? I use it for 1 year.
Depends upon what is the condition. You know, if suppose it goes out of its properties, the elasticity and the compression, you should. It depends.
Acha, otherwise it can be used for 1 year.
If suppose it is in a good condition with a good compression, has not been spoiled. You are taking care of it very nicely, washing it, not stretching it, and that way twisting it. So it would last for long. But then you have to see the moment it gets something change in its properties, you should change it.
Yeah, I have one more thing to ask. Like how. Every time I'm buying it, should I measure my lymph every time, or the same size can be bought every year?
No, you should be going in for an opinion of certified lymphedema therapist to know whether your requirement has changed.
Okay.
You will not be able to judge by your own self.
Right. Thank you. Thank you so much.
Thank you. Bye-bye.
Okay, so I think I will thank Dr. Rohini Patil, and thank you for all of the participants who've patiently also sat and been there. I think it is clearly a topic that needed to be discussed. I think we've had more questions than we've ever had in any of our webinars, I think. So clearly it's a really critical topic, and I think Dr. Patil, you really did a good job, and very detailed explanation. Very patiently, you've sat for 90 minutes answering all these. And we also would like to thank Keka for demonstrating the exercises as well. And I think all of you who are on, if you're not on the Cancer Power Circle Facebook group, please join. Hi, Keka, thank you. And and any suggestions on topics that you would want us to cover, and not just breast cancer, any of the cancers that you would like to cover, please do write into us. And we are definitely receiving questions about lymphedema therapists in various cities. So I think I'll talk to you separately as to what we can do, because apparently some cities don't have therapists and so on. So
they do have what I told you.
Somebody came back and checked that they found on Hyderabad doesn't have, or some such thing. So anyway, I'll discuss that separately.
We would help. We would be in touch and we would help them. Yeah,
right.
Surely.
Right.
Thank you so much.
Okay.
Thank you, Dr. Rohini.
Okay. Thank you for giving us the opportunity to reach out to all of them.
Sure. Thank you. Thank you all. Thank you all the attendees for joining as well.
Bye-bye.
Bye.
Bye.
Bye.